Hello again. The World Health Organization's Europe region includes 53 countries. The UN body has seen forecasts made by the University of Washington and agrees that an unprecedented wave of coronavirus infections is going to hit the area over the next 6 to 8 weeks. It's warning that more than half the population will contract the Omicron variant, with a corresponding rise in hospitalizations. But it also says vaccines continue to prove protection and reduce severe illness.
The Omicron variant represents a new west to east tidal wave sweeping across the region on top of the Delta surge that all countries were managing until late 2021. How each country now responds must be informed by its epidemiological situation, available resources, vaccination uptake status, and socio-economic context. The region saw over 7 million newly reported cases of COVID-19 in the first week of 2022, more than doubling over a 2-week period.
So 53 countries in the WHO's Europe region. 27 of those countries make up the European Union. Jack Parrock is in Brussels. He says the bloc knows that vaccines alone won't stop this coming wave.
Numbers, as we heard there from the WHO, are rising significantly. It is important to say, I think, that the European Centre for Disease Prevention and Control, as soon as the Omicron variant came out a few months ago, well, just over a month ago, basically they were saying there needs to be some measures that aren't just vaccines to try to prevent this. And we have seen that kind of lockdown in a number of countries. In Austria, for instance, there's been more restrictive measures here in Belgium. We've seen a much more stringent forcing in France of the adherence to the vaccine passport. For basically anything that you have to do in France, you need to show that pass, encouraging people to try and get their booster shots. As we heard from the WHO, they're encouraging each country to deal with their own epidemiological situations. But we know, Adnan, that those situations are getting worse.
The United States now has more people in hospital with COVID-19 than ever before. Government numbers for Tuesday show almost 146,000 people in hospital. That's more than the previous peak in January last year. Numbers have doubled in the past 3 weeks, with the Omicron variant overtaking Delta as the country's dominant strain. Hospitals in several states are reporting staff shortages. Many have suspended elective procedures because they are struggling to handle the rise in COVID-19 patients. Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter's Medical School. Doctor, welcome as always. So, with the WHO's prediction for the European region and what we've just heard from the United States, surely faced with such huge numbers to come and already here, it's a question of which mitigation policies are the best.
It's a question indeed, and we should have all mitigation policies in place. As we have repeatedly said, controlling Omicron is a multifaceted approach, and therefore the one thing that we have to do is immunize, and by immunizing at least you don't end up ill in hospital and dying. The other bit is wear your mask, wear it properly, and then the other bits are reduce your human-to-human interactions, because really this is a human-to-human spread of infection. It is very infectious. It will find you, and therefore if you take your multi-layered approach to protecting yourself, you are putting yourself in a good position.
I want to just use the United States and the United Kingdom as two examples, because the United States has the most COVID-19 deaths of any country in the world. And for Europe, that is the United Kingdom. More deaths here in the UK than any other European country. Many analysts are saying those two nations don't have enough mitigations in place. There might be a political issue there. From the health point of view, the analysis is, and I want to know if you agree with this, that the lack of mitigations in these two countries are going to come back and haunt those two nations for many, many years to come. For example, in the UK, a country of about 60-odd million people, apparently 1.3 million people are currently living with long COVID.
Yes, you're absolutely right. And it is also very saddening. Not only that, remember, the more cases of COVID that we have, the fewer operations, the fewer cancer treatments, etc., that we do. And therefore, our deaths are not only COVID related. Our deaths are those operations, those interventions that we failed to do because we didn't have the beds. So yes, we are in trouble, and this is a sign of we could have done better, we could have done much better. We are an educated nation, and considering we are highly educated, we took our actions late, we didn't take our actions extensively, and we are still reluctant to keep on having those precautionary measures to keep the case numbers down.
Actually, you know what, to be fair to the devolved nations, Wales, Northern Ireland and Scotland do have more mitigations in place, certainly than England, where there are very, very few. So it's people looking at England specifically as possibly a bad example. What do you make of those countries? And there are an increasing number who are reducing the isolation time for people who test positive for COVID-19 to 7 days, some making it now 5 days. There was that new study in Japan. You saw it, right? That between 3 to 6 days after a person has symptoms with Omicron, that's when they have the highest viral caseload. That means if you've been isolating for 5 days and go back to work, you've still got the highest viral caseload you'll have with Omicron.
And therein is the way out. And I have been saying this for several weeks now, which is if you reduce the number of days of isolation, you have to do some other measures in place. And that other measure is do your lateral flow device tests properly. And if you do 2 lateral flow tests 24 hours separated properly, you're putting yourself in a better position. Having said that, as the Japan study clearly indicates, there is nevertheless a risk that we will be releasing some people who are still infectious into the community because we've reduced the isolation period. Therefore, I say the best thing is be immunized. At least if you are infected after being immunized, your infectious period is reduced and the amount of virus that you release is also reduced.
Dr. Bharat Pankania, we always appreciate it. Thank you so much indeed for joining us on the News Hour.